of medical detective work. It all centers around something called the Nicoladoni Branham sign. And really, it's a story about how one simple observation can unlock a super complex puzzle inside the heart.
So, let me ask you this. Could a single, simple press of a thumb on a patient's arm actually reveal a hidden, maybe even life-threatening condition that all the advanced tests might miss? I mean, it sounds kind of crazy, right? But that's the question we're digging into, and the answer? Well, it's a surprising yes.
So, let's set the scene. Imagine a patient comes in, and they're showing all the classic signs of cardiac ischemia. You know, their heart muscle just isn't getting enough oxygen. But here's the thing, all the usual culprits, like blocked arteries, they're just not showing up on the tests. So the whole medical team is left scratching their heads, facing a real puzzle.
The real challenge in a case like this is figuring out what's putting this hidden strain on the heart. Because sometimes the heart is working way over time for reasons that are not obvious at all. It's pumping like crazy, but for some reason, the body still isn't getting what it needs. Doctors need a clever way to unmask the true culprit.
And this is where the hero of our story comes in. And it's not some high-tech million-dollar machine. Nope, it's a simple bedside clue, a physical exam maneuver known as the Nicoladoni Branham sign. This is the key that can unlock the entire mystery right there in the exam room.
So what is it exactly? Well, the Nicoladoni Branham sign is a test where a doctor just applies a little pressure to the main artery right before a specific kind of abnormality, something called an arteriovenous fistula. And the whole point is to just watch and see how the rest of the body, especially the heart and blood pressure, reacts to that tiny temporary change.
And you won't believe how straightforward it is to actually do this. First, the doctor finds the AV fistula. You can often feel it as this weird vibration, a thrill. Then second, they just compress the main artery that's feeding into it. That's it, a simple two-step move that gives you this wealth of information.
So what you're looking for is a positive sign, and that means a very specific set of things happens almost instantly. The heart rate slows way down, that's bradycardia. At the same time, the blood pressure actually goes up, that's hypertension. And right where you're pressing, the buzzing and vibration from the fistula just disappear. Any swelling might even go down a bit. These are our 4 crucial clues.
But why? Why does all this happen just from a little pressure? To get that, we need to look at the science. We're about to explore the incredible physiology of what's basically a short circuit in the body's wiring, its circulatory system.
Okay, so the problem starts with this thing, an arteriovenous fistula. An AV fistula is an abnormal hookup where high-pressure blood from an artery flows directly into a low-pressure vein. And the key part is that it completely bypasses that huge, high-resistance network of tiny capillaries where all the oxygen exchange is supposed to happen. It's like a highway detour that just skips the entire city.
Now this slide really shows you the heart of the problem. Your normal circulation has high resistance from all those capillaries, and that's what keeps your blood pressure stable. But with an AV fistula, you've created this giant low-resistance leak in the system. That makes the overall resistance drop, and your blood pressure tends to go down with it. So what does the body do? It tells the heart to beat faster and faster to try and keep up. That's called reflex tachycardia.
And this is where it all clicks into place. The chain reaction when the doctor presses on that artery. Step 1, you block that low-resistance leak. Step 2, all of a sudden, all that blood is forced back into the normal high-resistance capillary beds. So, resistance shoots up. Step 3, this causes the blood pressure to spike. Then, step 4, pressure sensors in your body, called baroreceptors, they totally freak out and send an alarm to the brain. And finally, step 5, the brain tells the heart, whoa, too much pressure, slow down. And there you have it, bradycardia.
So, we've seen the sign, we get the science, now let's tie it all back to our patient. What is this simple bedside test really telling us? What's the culprit it helps us unmask?
Okay, so here's the most important takeaway. The Nicoladoni Branham sign isn't just some cool medical party trick. It actually unmasks a really serious hidden condition. That fistula is forcing the heart to work incredibly hard, 24/7, constantly trying to maintain blood pressure against this leak in the system.
And that condition has a very tricky name, high-output heart failure. Now, I know that sounds like a total contradiction, right? Heart failure, but high output? It's because the heart is actually pumping a huge amount of blood, way more than normal. But since so much of that blood is just getting shunted uselessly through the fistula, the body's tissues are still being starved of oxygen. The heart is running a marathon, but the body's getting zero benefit. And this is why this simple sign is such a game changer. For that patient who looks like they have cardiac ischemia, this test points the doctors to a completely different and correct diagnosis. This little bedside maneuver lets them make a timely diagnosis, which means they can do the right intervention, which is usually repairing the fistula, and see a dramatic, incredible improvement in the patient's health.
So finally, let's just take a second to appreciate the legacy of this amazing diagnostic tool. It wasn't dreamed up in some high-tech lab. It was discovered through the simple power of careful observation. The sign is named after Carl Nicoladoni. Back in the 19th century, he was treating a patient with some kind of vascular issue in his arm. And he just noticed something. He noticed that the patient's pulse slowed down every time he happened to press on the main artery feeding it. That's it. A simple, repeatable observation that became a cornerstone of how we diagnose heart conditions.
And that really leaves us with a final thought, doesn't it? You know, in an age where we have all this incredible, complex medical technology, the Nicoladoni Branham sign is such a powerful reminder of the value of just the physical exam. It makes you wonder, what other simple, powerful discoveries are still out there, just waiting to be made right at the patient's bedside?